now we're going to talk about the fourth cranial nerve. The fourth cranial nerve nucleus is on the midbrain, usually between the inferior and superior colliculi. Then the nerve is going to out inferior to the inferior colliculi of the midbrain. You could also think it as inferior to the red nucleus, both from the rostral part of the midbrain, and then goes to the ventral part, so goes in front. And the fibers of the fourth cranial nerve decussate before innervating the target organ or the destiny. It's the only cranial nerve that decussates before. Now the action of the fourth cranial nerve is to innervate only the superior oblique muscle of the eye. So this muscle, what it does is, here's the eye, here's the pupil. There are three movements that the superior oblique muscle produces. One is because here is the eye, here is the superior oblique muscle. When the muscle is contracted, does something like this, and so makes that the eye looks down. So one action is depression of the eye. Depression. The other action is abduction of the eye. And the third action is intorsion. Intorsion of the eye. Intorsion means, let's say this is the right eye. We are looking at the patient like this. The patient is like me, looking to the camera. So this is the right eye, so the nose would be here. Here's the nose. Here's the nose. So intorsion means that the eye is moving from the 12 o'clock position, so from here towards the nose. So from this point to this point. This is intorsion. So when the eye is, let's say, in a adducted position, let's say here, and we want to depress the eye, so looking here, this action is mainly by the oblique muscle, because depression of the eye also can be performed by the inferior rectus, but the inferior rectus takes more action when the eye is abducted. So in order to test the fourth cranial nerve, it's a little confused because the fourth cranial nerve, when the innervation to the superior obliques, produces that the eye be abducted, depressed, and intorsion, three movements. The confused part is that the superior oblique muscle produces abduction. But in order to test the superior oblique muscle, we will ask the patient that first adducts the eye in order that the depressed movement of the superior oblique muscle be higher than the inferior rectus. We said that the action of the superior oblique muscle is to depress the eye and works better when the eye is adducted, because the inferior rectus contributes less in that position. So we will ask the patient to depress the eye, to look down, but first that adducts the eye and then looks down.